The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering bio-identical hormone replacement therapy. With us, we have an expert on the topic, Dr. Stoller. Dr. Stoller, welcome to the program.
Thank you, Randy.
All right, now, before we get into today's topic, and I know you've been doing this for quite some time, but tell me about your practice. I mean, who is the typical patient nowadays that comes in for bio-identical hormone replacement?
The majority are ladies whom are maybe preparing to go into their menopause, in it or even through it, whom have lost the vitality of their lives.
Okay.
They're feeling tired, depressed, may not have the response with lovemaking with their significant other, and just a menagerie of things that are happening. Depressed, skin is changing, emotions are changing, hate their husbands at times.
All right. Okay.
And at our point, I remember some of those days in our own marriage. And so these are the people we're seeing typically. And when they get better, guess what? They bring their husbands.
Is that right?
It's exactly right.
So you've been doing this. We should mention this. And I met you, by the way, at an anti-aging conference where they had hundreds of doctors.
Correct.
Sharing ideas.
Exactly.
And you're one of the guys that have really been doing this, a lot longer than most.
Yes.
Tell me about that.
Well, I attended I didn't go to learn this. It just happened that at Vanderbilt University, I went to a big conference, and the guy that was the chairman of the reproductive endocrinology department, Joel Hargrove, lectured on what that time was called a micronized estrogen and progesterone, which was bioidentical.
Okay.
And I saw the benefit, and as he lectured, it just shocked me at what I've been doing with the women I was giving horse estrogen to and synthetic, not progesterone, but progestin. I promptly went home and took quite a few hundred women off of that and changed them, and the results were, as you would expect, very positive.
Was it a big difference immediately?
Yes, very definitely.
So putting them on natural hormones?
Yes.
And that was since about what time? By like 1987 you've been doing this?
87, yes. The technology's changed. At that time, we were using blood tests to monitor this thing, and I've been monitoring it for years.
What's wrong with the blood?
Well, you tend to get falsely low values. And one of the things we've learned is that you don't treat numbers, you treat a patient.
Okay.
So had we have treated...
What does that mean, by the way? What does that mean?
You treat them until they feel better.
Okay, good
and
point.
So, by doing the blood tests, when I retrained, I have some of those people coming back, and they're all overdosed because they went to physicians whom didn't have a clue as to what to do, so they continued what I was doing, and I'd been over-treating them. So we've reduced the dose.
So you do it with what? You do the testing you do, saliva, urine?
Yes. 24-hour urine collection.
And you get more accurate
yes. And
view of the hormones that are,
yes.
Active?
Yes, and I like the 24-hour urine because I get the metabolic breakdown products, which helps me to monitor this. It also helps me to monitor the 2, 4, and 16 hydroxy estrogen, and you want to keep that in balance because if you get it out of balance, you can create as much trouble as you're helping.
Okay.
So you need to watch it.
You say you're changing people's lives, women's lives.
Dramatically.
How so? Give me an example of somebody that comes to you, maybe they're a mess, you do bioidentical hormones, nutrition, etc., and now they feel great. I mean, tell me about that.
Well, some of them have written me an email, testimonial, and we've published them on the website. They've given me permission.
Okay.
And, they come in with, maybe they're having crying jags, they can't sleep, they're gaining weight, they feel tired, their fingernails are not right, and, it just goes on and on and on. And what will happen, and it doesn't happen overnight. We have people feeling a lot better in 2-3 months, but it may take a little longer. But we're making them happy again. They're having a wonderful relationship with their husband. But you know what happens? They end up bringing the husband in too.
So the sex drive comes back.
Oh, very definitely. And
what about memory, things like that?
Oh, it improves.
Okay.
And they're resting, and so if they're going to bed in 7-8 hours at night, they're getting up rested, which they would not do, and they don't have to take mid-afternoon naps. And we just remake them. We give them their life back. We give them their quality of life back.
You say, we talked on the phone. It was very interesting. You say, Randy, since I've been doing this with women since '87 with natural hormones, that you're so much better now.
Oh, yes.
Than you were then.
Yes.
What's changed though?
Well, at that time, I thought it was just changing, giving them bioidentical or natural estrogen and progesterone, and then testosterone and DHEA. Did some pregnenolone. Got a little concerned about that because I couldn't control the metabolic pathway it went down and what it ended up in. And you know, I'm not adverse to using it. It's just you got to be very careful, monitor it very carefully. But I didn't understand the totality of the thing. Like initially, I wasn't doing the right thyroid hormone evaluations. Didn't understand the significance of vitamin D, vitamin D3, and these were things that were missing. And so we were getting there, but we weren't there like we are today.
You know, I also asked you this, and by the way, if somebody's just tuning in, this is not an endorsement for you. I'm just asking the questions. It's a real interview, but it's very interesting. You know, I do endorse the fact that you've been through this fellowship.
Yes.
That's doing this. But you told me something on the phone. I said I don't like to ask this on camera because it sounds like it's salesy or something. But I said, what makes you feel like you're better than some of the other guys that are dabbling in anti-aging medicine? And you said the training that I have with the anti-aging medicine group or the fellowship just puts me at a big advantage. And that advantage is what?
Well, we're understanding that there's more to it than just giving hormones.
So would you say you get better results?
I get dramatically better results. And we're giving people their lives back. What I now know, and I've known this for a while, we can roll our biological clocks back 25 to 30 years. And, you know, I feel like I've done that personally. And we're seeing this in our people.
That's a big statement, by the way. Am I going to have to put disclaimers all over the place? What do you mean you could roll it back? I mean, feeling? I mean, you could feel?
Oh.
Because I know your age, by the way.
Yeah.
And people would be very surprised.
I've got 14 grandchildren. They're in college.
Okay. Because you live this. I mean, you have great skin. I mean, you're into this.
I live it. You know, I'm training right now to do a 168-mile ultramarathon on a bicycle. I have a racing bike. I've ridden 50,000 miles and raced many of them. And so, you know, I'm doing what I'm saying.
You say you can't even hang around with people your age.
No, they bug me.
They're like little old men.
You know, yeah, they are. You know what the measure of a human being is little people talk about other people. Average people talk about things and events. Big people talk about ideas and concepts. And you know what? That third category is the people back 20, 30 years younger than me. The ages of my sons.
Okay.
And my daughter. They've got life. And when people are my age, they're thinking about talking about a ball game. And that's fine, but, you know, it's a matter of the focus of your life. I'm still on the creative edge, and there's a dramatic difference.
Good for you. And I mean, you see those changes?
Do I see
that a 40-year-old woman, 50-year-old woman, you bring them back psychologically, mentally, feeling?
Yes.
When it really?
And part of that is eating patterns. We're not too good in the United States with the way we eat. So we're helping people to understand how they ought to be eating. And that makes a tremendous difference because of the nutrient value they're getting. Although we use a lot of nutraceuticals, but eating is important.
All right, let's jump right into bioidentical hormones. Okay, so what are the frequently, you know, a woman comes to you, she's in her 40s, she has some symptoms. What are those symptoms? And what are the commonly replaced hormones?
Well, symptoms can be anything from the way acne may be coming back, arthritis. They may be having bladder issues, sometimes infections, and they've never had them before, or pain with urination, urine loss. They may be having decreased breast size, a loss of interest in a physical relationship with their husband or significant other.
Hot flashes, right?
Hot flashes, and vaginal dryness. And, you know, the putting on of weight around the waist and the inability to get it off with exercise and quote, diet.
Okay.
And
so is this all, in your opinion, just so I'm trying to understand this, that they're in hormonal decline?
Yes.
Almost?
Yes, they are.
So you restore hormones.
Yes, we do.
And they feel like they used to feel?
They get it back. They do get it back. And you know what happens is as that comes back then, the interest in exercising, which is a critical component, and modifying the lifestyle, the interest, the desire, and the energy to do it returns.
Very interesting.
It returns.
Okay, so what are the commonly replaced hormones?
Estrogen, and there are three different estrogens. We replace two. Progesterone, testosterone, DHEA, vitamin D3, thyroid, and we see a lot of problems with people who have adrenal decline, and that's something I was never taught before, but where they're just not making adequate cortisol because of stress, maybe toxins, whatever, and getting that back up to speed.
Okay, now let's talk about the testosterone. You know, in women.
Yes.
Because I guess you just don't think of women with testosterone.
Well, they have it.
How do they know if it's low?
Well, that's part of the reason for the decreased sex drive, although estrogen can be. But these things all intertwine, and so you can't isolate and say, well, because there's a decreased sex drive.
But what is testosterone, though? I mean, how do you
It's a male hormone.
Okay.
It's a male hormone.
All right.
And women have a small amount. Men have a bigger amount. And so we do little tiny doses in ladies, and just enough to bring it back to the level where it was at in their mid-30s, not beyond. We just want to bring it back to where it was before they began to decline.
So what's it responsible for in a woman?
Well, orgasmic response is probably one of the big things. The other is giving them a lot of energy, putting some vitality back into their life. And it helps the skin. It helps with muscle tone. Part of the reason that women begin to lose muscle mass is because of the decline in their testosterone. So we're bringing that back so they can respond to the exercise and build muscle mass back. And then, of course, the orgasmic response is, I think for most of the women, that's the thing they're really looking for.
All right, okay, estrogen, progesterone. And I have questions about this because, a lot of the things, anticipating this interview, estrogen can be negative. Estrogen could cause cancer,
Yep.
some people feel. What are your thoughts? And what is your, what is your response to that?
I'm embarrassed to say that I have written thousands of prescriptions for horse estrogen. It's a foreign estrogen.
Back in the old days?
Back in the old days. Haven't done that in a long time.
Okay.
In fact, I haven't done that since about 1986 or 87. But now know that converted into a bad estrogen that preferentially went to the breast, that was responsible for the increase in breast cancer in the World Health Organization study, and it has some bad effects. What we do now is using bioidentical or natural hormone, and we use what's E2 and D3, and it depends. It's all over the place because we compound this and we make it in the ratio to meet the need of the individual. Not one size fits all people.
So what's estrogen good for a woman?
Vaginal mucus. It brings the skin tone back. It helps with depression, particularly progesterone. Helps with depression, energy levels, mood levels, depression, clearing up cognition. Estrogen receptors are in the eye, so it's preserving the eye and helping protect against macular degeneration, which is a scourge of the aging population. Cognition. We have seen people that have Alzheimer's disease. I have done a lot of this in the last 3 years. And if we can get them on estrogen, we see them perk up. And their cognition, their mental status improves. Their scores improve. We have objective data.
So do you give it alone? Or do you always give it with?
Always with progesterone. We put in.
Interesting. So progesterone.
Yes, always balance it. The other is a little testosterone, a little DHEA, and then we look, at the other measurements.
But now this whole, this term estrogen dominance. When I hear, I talk to some doctors, they say, well, having enough estrogen is not the problem. What are your thoughts?
Well, when I look at estrogen dominance, to me, it's an academic interest. I have not yet seen a lady who has excess estrogen. I know they're out there. I just haven't seen it yet. But what they need is progesterone, and just bring the balance back to where it should be at.
So the ratios are what you're looking at between estrogen
and progesterone.
And progesterone.
Correct.
Okay.
Yeah, we just want to get that back to where God designed it to be at and get it there.
So tell me about progesterone. How does a woman know if she's low in it, and what's it good for?
I think progesterone, several of the biggest things. One is lack of ability to sleep. Feelings of depression are probably two of the biggies that women that are low in progesterone feel, and you can directly impact that with progesterone, particularly if we use a timed release capsule.
Have you had women that come in, they're depressed or anxiety or whatever, and progesterone or whatever we're talking about here?
I usually don't use progesterone alone. I use it with estrogen,
okay.
but I use a lot. I use a progesterone 100% of the time in the women because they all need it, and the results are predictable. I mean, it's absolutely predictable. Don't use progestin, progesterone.
So when should somebody do this, though? Okay, so a woman's watching this, 40 plus, okay, and I mean, when should they look into this?
Today.
Really?
Today.
Okay.
The younger the better. In fact, the comment is that the time to be really looking at what we're doing is when the baby is in the uterus, because we can impact the intellectual level of that child.
Is there any science behind what you're saying?
Yes, there is. There's studies.
Okay.
Yes.
Okay, but back to when should they do this? Okay. I mean, what are the signs where they need to look, get their hormones checked? What are they?
Fatigue, the things that we've just talked about, but fatigue, lack of response sexually, sleeplessness, Skin changes, skin wrinkling.
What about
lighting.
PMS? Does PMS increase with age? Is that one of the symptoms?
No, well, in my experience, and I can only speak from my own experience, is that as they go into the postmenopausal phase, they're not menstruating anymore. So by definition, that begins to lessen. So I don't, in my population group, I'm attacking a group of people now that are perimenopausal or postmenopause, and that is in the past.
Okay, but when it's just starting, could PMS be?
It could be an issue.
Amplified?
Amplified to this? No, it should be controlled. It should be benefited, but you got to balance it. You got to be very careful.
But I mean, could it be amplified as part of a symptom of early menopause?
Yes,
okay.
It could be aggravated. And again, you got to balance the hormones. You got to measure it. And I keep coming back to the same point. You got to know what you're doing with this thing and measure it. And you need to be seeing a physician that is fully trained in the anti-aging metabolic specialty, so they understand the tests that need to be done.
So would you recommend that somebody that's going to do anti-aging medicine, okay, or look for a doctor that's doing this kind of bioidentical hormones,
right.
Should they ask, are you fellowship trained?
Yes. Not only are you fellowship trained, but if you pass the boards.
With the anti-aging medicine?
Yes. And I say advanced fellow. That means you've taken all the courses.
Now clear this up for me, because you say even the Anti-Aging Society doesn't like the word anti-aging sometimes, because you're not anti-aging. Elaborate on that. What do you mean by that?
You know, this is kind of funny, but I like to think in terms of maturation. Maturation is appropriate. Aging is a disease, and we can stop that disease. So we mature, and there is a difference, and maybe it's just in our thinking. You know, I don't think that I'm the age I really am chronologically, and physiologically I'm not there. So what we're doing is we're altering that process by taking the individual back to their mid-30s or very early 40s and recreating the hormone balance that they had
back then
before the decline.
Interesting.
And that's what we do, and that's what delays this thing.
Now, do you think by giving people hormones, and I realize if people are just tuning in, we're talking about bioidentical hormone replacement therapy for men and women, and I realize, you know, this is a big topic. You said I don't want to give the impression, but you look at exercise, nutrition, supplements, stress, sleep, and all of those things. We're just happen to talk about bioidentical hormones right now. But so the hormone levels, you take somebody in their 60s, so I'm catching you right here, and you return them their levels back when they were in their 30s, 40s.
Correct.
And you say that they feel
they
the way they
feel
used to.
markedly better.
Okay.
And I need to add too, we do not precipitate the return of menstrual periods. I have yet to meet a lady who is postmenopausal and no longer menstruates that wants to start. And so we don't do that.
So some people do.
They do, and I saw that when I was not doing it properly when we were doing the blood tests, because I was over-treating them. I don't see that anymore. That's a non-entity.
Do you think it's protective when in my limited research, that some believe that it's protective, helps with your heart, helps with your brain, bioidentical hormones, of course, combined with proper nutrition.
Right.
What are your thoughts?
I think there's a lot of evidence that is the case. In fact, the evidence is strongly in that direction. And frankly, that the World Health Organization used the wrong product. They used horse estrogen and a synthetic progestin, and it backfired on them.
So the bad press was synthetic.
That was right, but the press didn't differentiate. They didn't understand that there is a difference.
Okay.
The natural hormone, the bioidentical, has been going on for 60 years, and it's not being implicated in these issues. But we could be in trouble with people that don't know how to do it, doing it, and misapplying it.
Okay.
So you've got to do it right.
So the positive message here, though, because, so in Indiana alone, thousands, maybe 100,000 women, 40 plus, that feel lousy, that don't have to be. Is that your feeling?
That's exactly correct. And I know I'm right.
Really?
My experience just clearly indicates that I'm correct.
So it's just about, so is this healthy aging? Is it age management?
It's age management. Healthy aging, both are appropriate, but we're helping people. If your life expectancy, and I'm afraid to verbalize my life expectancy for myself because it's well past 100.
Okay.
But let's say it's 100, which I don't think is ridiculous. The whole concept is to keep that person functioning optimally to 100 and die. And we can actually measure by measuring telomerase. So we can do this. We can look and see where are you at on the decline, or are you maintaining yourself? And we can objectively put data to that. We know that.
We're going to take a quick break. When we come back, though, thyroid for weight loss and how someone may have a thyroid problem and what they could do about it. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, natural hormones. Are you a candidate? With us, we have an expert on the topic. He is fellowship-trained physician, medical doctor, Dr. Stoller. Okay, we've talked a lot about hormones today. Okay, so for women, thyroid. A lot of questions about thyroid and weight loss. You know, I went on the internet, I'm reading thyroid, and I'm going, I must have thyroid, right? It sounds good. Yeah. So tell me about it.
Well, you know, certainly there's a symptom overlap between that and all the other hormones. But, you know, the biggies would be brittle nails, dry hair, brittle hair, hair loss, fatigue, weight gain, cold hands and feet, and just not having energy, just low energy levels. And if you do this right, you can have a big impact on it.
But you say that it's not a quick fix.
It is not a quick fix. It takes time, and it takes monitoring.
But many people don't need it, you say. Many people are given thyroid, they don't need it.
I would agree with that.
What does that mean? What does that mean?
Some people are getting thyroid hormone, probably the wrong hormone, and you need to look at this thing. In the population group that I serve primarily, probably aging has got something to do with their inability to convert the least active form of thyroid hormone to the more active form. And so you have to differentiate that, and oftentimes all we need to do is to give the very active form, which we abbreviate T3, and that's all they need.
Okay.
And you just bring that back until you normalize the test and the patient feels better.
Okay, good.
We're treating a patient. I'm not treating a number.
Okay, so now when a patient goes to see you, okay, so it's a woman, let's say 40 plus, and I know you do men too.
Oh, yes.
But 40 plus woman comes to you, anxiety, depression, all of these things, or depression. Like they weren't depressed their whole life and now all of a sudden they're feeling depressed. How is there a hormonal connection there?
The whole thing is very tightly interrelated. So much so that
But isn't it a neurotransmitter problem and not a hormone problem?
Yes, but it's a lot of other things, and it's a very complex story. We will get into measuring all these things initially to try to rectify them. But the neurotransmitters, oftentimes, if you correct these other factors, self-correct.
Okay.
And so there's a lot of what we don't have to attend to if we correct the big issue, and that's the hormonal issues. And then the neurotransmitters oftentimes come into balance.
Okay, but these antidepressants, I mean, they do work for people.
Sure.
Are you able to wean people off? Is that your goal?
Absolutely.
Have you ever done it?
Yes.
Really?
Yes, and they do come off. And you know what? They feel real again. I get this comment, I feel like I'm outside of my body. I don't feel like I'm who I am.
Really?
And this comes, the natural feel comes back. So I don't have to coach them off. Or I guess I coach them off. I direct their coming off. I don't just stop at cold turkey. But they're pushing me. Can I stop now? Because I don't like how I feel. I feel plastic. And
okay.
I don't feel like I am who I am.
Now, so you see the symptoms of menopause every day in your practice?
Absolutely.
Reversed?
Reversed.
Or diminished?
Actually, diminished short-term, reversed long-term. What I mean by that, over 3 to 6 months, diminished dramatically, maybe a year until, because we're fine-tuning this and we're orchestrating this. It's a symphony.
Any overnight successes? Anybody that you give testosterone or progesterone and then a week later they go, oh my goodness, I've
had a few.
Really?
Yes.
Okay.
Yes. That's been a pretty aggressive broad front that we've gone after because we've treated their adrenal issues, thyroid, and hormone and other hormones, sex hormones. And yes, 1-2 weeks we've seen some turnaround. Are they cured? No. But we've had them feel better. And so we normally see them back in 30 to 40 days, and they come in feeling better.
Now, you're board certified, and we're out of time, but in family practice medicine, and the part we haven't talked about is you deal with very sick people, too.
Oh, yes. Very sick.
Like the doctor of last resort, sometimes?
Yes. Unfortunately, it is that. I wish I could have seen them earlier. I have folks that my wife helps me in the practice, and afterwards I'll say, if only I could have seen that person 5 years ago. If only I could have seen them 5 years ago.
Really?
Yes, and it's very heart-wrenching. And I particularly saw that when I was doing home medicine of taking care into the home of the elderly that could no longer get out. And my hope is to reach their children, because they've got a statistically greater probability of having the dementive process than the population at large. Somehow you think it's like the guy that smokes cigarettes. I'm not going to be the person that gets lung cancer. I got bad news for you. And
Interesting. Well, tell me this, and we are out of time. Okay, so we talked a lot about the younger women, 40, 50, but they're coming to you now at 60 and 70, 75, first-timers. What do you say to that group that's watching this? They're going, I feel pretty good. You know, it's just part of aging. Feeling tired, and what do you say to them? And we have to wrap up here, but what do you say to them?
And some of those people that come in that say, well, it's just my process, it's my time of life, some of those people I may not be able to help. If they have got a mindset, if their paradigm is that this is the way it's to be, I may not be able to reverse that. Can I? Absolutely. Do I do it? Yes. Do I do it often? Yes. And so I don't care where you're at. I don't care if you're 85. It's never too late. We've seen people in their 80s that we've cognitively improved them. It doesn't matter. As long as you've got a breath and a pulse and a temperature, you can have benefit.
Okay. So the second half of your life can be the best half of your life. You believe that?
I not only believe it, I'm experiencing it.
All right.
I'm experiencing it.
All right. Okay, so they can go to your website, find out more information.
Yes.
Call your office, meet with you.
Yes.
And get started. I want to thank you so much for coming on.
Thank you.
Big topic. We're going to have you back.
Thank you.
Been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, we'll have it on our website at wellnesshour.com. You can just put in hormones or Dr. Stoller, and you'll find it there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.